welcome to those who may have just joined. We have the pleasure of speaking with Dr. Drew Tortoriello from Sher Fertility Solutions today, giving expert tips on how to manage IVF, how to manage the stress, how to manage the injections, how to look after your relationship if you're in one, or your family, friends, how to think about diet, nutrition, holistic well-being. He's written a brilliant article all around this, which we have linked up in our bio, so please check it out. And it's tips for staying, there we go, he's here. Staying sane whilst having IVF, or going into IVF maybe for the first time, second time, third time, every feeling that you might be feeling. So please have your questions. Hello, good morning to you.
Good, whatever it is over there for you.
Yeah, bit later. How are you?
I'm very well. I'm very well. Thank you for having me today to chat.
It's a pleasure. It's a pleasure. So please give yourself an introduction. I have already, but please tell everyone a bit more about you and Sher Fertility Solutions. And then let's talk about staying sane during IVF.
Sure. My name is Drew Tortoriello, and I'm the medical director at Sher Fertility Solutions in New York City. I've been here for probably about maybe 15 years or so, working with Dr. Jeffrey Sher, who is one of the pioneers in the field. Our practice is a practice that is very patient-centric, less factory-like, more boutique setting, sort of a facility where we really try to cater to our patients' emotional as well as medical needs during the process. I don't know what else you'd care to know, but I think that's a very nice encapsulation.
It is, and someone's just said, Dr. T, he's the best, so there we go. You've just written a fantastic article for us, so thank you, on our website. The link is in the bio, which is all around tips for staying sane during IVF. And this applies to anyone who's coming at IVF fresh for the first time, or for anyone who may have had previous cycles and are dealing with the anxieties and the uncertainties that come with that. So I have some questions I'd love to ask you. And for everyone watching, if you have any questions for Dr. Tortoriello, please do ask. The first one is a bit more holistic. It's about mindset. Do you have any suggestions for patients you see in terms of shifting your mindset to your advantage when being faced with anxiety such as fertility treatment?
First, let me say that it's completely and utterly understandable to have anxiety, because you're dealing with both the issue of the infertility as well as a fear of the unknown. You're going to be potentially having a treatment that involves, multiple monitoring visits, ultrasounds, blood draws, etc. So it's totally normal, and the first thing you should realize is that it's okay to feel that way. I think among the best things that you can do are to talk to people who can offer you appropriate insight. And the first and foremost, it should be your physician. You should find yourself in a position that when you speak to him or her, you are getting a very complete picture. You don't feel rushed. All of your questions are being answered appropriately, so that when you leave the office, you're not going to be able to open up your own fertility practice, but you're going to be able to go home and have a very good idea. I'm going to do these medications for this particular reason, and I should expect these particular results or side effects. And I think if you know really, really clearly and concisely what to face, that goes a tremendous way to avoiding anxiety and nerves. Mm-hmm. Another very good thing to do is to, if you have the luxury to do so, is to talk to somebody who's been through the process before. And sometimes you can even ask your doctor, do you have anybody who would be willing to talk to me about their particular process that's undergoing it now? Or, because there's a lot of patients I get that say, if anybody has a question or want to get it from a patient point of view, you can use me as a resource. I'm very happy to do that. So I think it's good to talk to people who have done it, because they give you the inside scoop rather than the doctor's, sort of somewhat semi-detached perspective. And you can also get this sort of perspective online or in person at meetings such as, we have organizations here in the States, Resolve, and other groups where people get together and go over their process and their emotional response to what's going on. Mm-hmm. So that, I think, probably is the biggest thing you can do.
At Sher Fertility Solutions, do you have holistic care such as access to counselling, therapy for people who are struggling with anxiety and all of the feelings that are expected in common with the unknown of fertility treatment?
I like to think of myself and my team as the first line in terms of the counseling, because we are literally they're being on the phone or emailing till, you know, in the evening sometimes with our patients to give them the clarity that they need.
Mm-hmm.
We do work with a network of people, social workers, psychologists, and also we have organizations which are nearby. Sometimes we even use our own office for patients to get together and go over, you know, their individual fears and hopes and concerns during the process.
Okay, that's good to know. Amazing. In terms of preparing for a cycle of IVF, whether this be a first cycle, whether this be one after, you know, not a successful cycle, or perhaps after having a child and coming back for further treatment or starting treatment, side effects. Often people can be concerned about symptoms, bruising, potentially pain, or the unknown of injections. What's your advice for preparing and handling that part of the treatment if someone's undergoing IVF?
Well, first part always is to be aware of what they might be, and that starts with the physician and also with the nurse who can sit down with you and go over your calendar, things like that. And it's a pretty straightforward process, and thankfully with fairly few side effects and expectations of complication. In terms of the biggest, I think, initial fear is the fear of needles. A lot of people fear needles, obviously.
Mm-hmm.
Thankfully, the process has become a lot more user-friendly over the last few years, where we use less needles and very small needles. You can actually inject them in a manner that is helpful in terms of minimizing any bruising or pain. You know, we usually recommend that you can ice the area for a little while before you inject. That helps quite a bit. A lot of patients ask, can they have somebody do injections for them, which is fine if they have somebody to do it. That's a little bit more professional.
Yes.
But I find a little bit of guidance from the nurse, from myself. You know, they have a little bit of fear the first night, and then by the second day, they're good to go. They're able to do it with a degree of adroitness that is beyond their initial expectation.
You almost get into a rhythm of it, don't you? And once you've done it once or twice, it feels a little less nerve-wracking.
Yeah, I mean, half the pain is from fear. You know, anesthesiologists will tell you
Yeah,
that
exactly.
they try to calm their patients down if they're a little bit nervous before they undergo sedation, because that fear, that if they go to sleep with fear or anxiety, they're more likely to have pain when they wake up or even some movement during the procedure. But you can remove that fear either through showing them how to do it or they themselves do it and are successful. Then after that, it's not really so bad.
Makes complete sense. And in terms of staying strong, we've talked a little bit about the mind. Is there anything people can be doing to prepare their body from a medical point of view?
Well, the healthier you are, the better it is in terms of your egg production, egg quality, reaction to the medications, and recuperation from the process. So everybody ideally should be as healthy as they can be. I mean, in the real world, not everybody walks through the door with infertility and they're ready to run a triathlon or anything, you know. So, but I always recommend that if somebody has no overwhelming rush to do IVF, let's say the reason why you're not getting pregnant is because you have a tubal factor and you are 33 years old or 32 years old with good egg reserve. Maybe you're not exactly in the health that you want to be. You know, you can take 2 months, 3 months before you undergo the process to eat a little bit more healthy, lose a little bit of weight if you're overweight. If you're underweight is not good either, actually. You know, you can get a little bit of weight if you're underweight, you know. You can take some supplements, because although we don't truly know the window of efficacy for supplements, normally we say you should be on them a couple of months to try to optimize your ovarian milieu. Maybe you will get a slightly better egg if they're exposed to these antioxidant supplements for more than 3 days before you start the stimulation medication. Obviously, you should avoid toxins. Toxins, basically anything that you smoke, stop smoking. You know, alcohol in and of itself, there's very little redeeming qualities for alcohol in terms of fertility. There may be a little bit of benefit to a little bit of red wine here and there from the resveratrol that's in the red wine, which is a very strong antioxidant. But other than that, you should stay away from alcohol. Sleep is important. A lot of people, unfortunately, the stress of everything in daily life, don't get a lot of sleep. So you should do what you can to try to treat yourself to a healthier lifestyle before you embark upon the process.
And what about managing injections? We talked a bit about administering injections, but what about the protocol and staying on top of the dose that you should be taking? How do you update your patients at Sher Fertility Solutions about what they should be doing each day?
Well, we pick a dose based upon our expectations of the patient's responsivity. And a lot of the time that's fairly easy to do because they've done previous cycles and you have a history of what they've done, so you can just sort of go by that. If you don't have that, then you have to make your best, you know, judgments based upon their age and their AMH and their weight. And then we begin. And usually after about 4 to 5 days, we bring patients in and we take a look. I do all my monitoring with the ultrasound and with the hormonal levels. Normally I'm able right then and there in the room, upon counting the follicles and seeing their sizes, what I would want to do with their medications. Change the dosage higher or lower or maintain. But later on in the day, when the blood results come back in, we confirm that plan and let them know we're going to stick with this original plan or we're going to change things up a little bit. But you should let people know by the end of the day, they're going to have very clear where they're going to have to go in terms of their medication dosage. And I have a lot of people that actually want to know their hormonal levels. We have a portal system. They can go in, they can see their hormone levels. So they'll probably know ahead of me sometimes. Oh, my estrogen's a little bit low today. What do you want to do? And I didn't even see it yet, but I'll make a decision and we'll decide what to do. Knowledge is power for them.
Definitely. And do you have people who are anxious about messing up their dosage or doing the wrong thing? Because, you know, you've got to this sort of pivotal point and there's so much riding on it that there's that fear of, what if I do it wrong and mess up the cycle?
Yeah. Unfortunately, from time to time, things like that can happen despite our best efforts to counsel patients. You know, our nurses will go over all the patients with them and we send videos to reinforce the education. But when you are sitting at home and alone at night at like 10 p.m. with a bunch of needles on the bed, trying to figure out how to do it, it can be a little confusing.
Yeah.
Patients should know that if they have some confusion, they can call the service to get some guidance, which I think every practice affords that benefit. We certainly do. The other thing to know is that if there's a mistake, most of the time the mistakes are not deal breakers. If you take a little bit less medication, a little bit more medication for one evening, likely you're going to be able to sort of ride over that little bump in the road and not have any long-lasting problems.
Yeah.
The main thing that people, I think, should do should be aware there are certain medications that are definitely crucial to not miss. Things like the GnRH antagonist medications that prevent ovulation.
Right.
So they should always make sure they have the appropriate dosage of that, because that's probably the one medication that if you miss a day, I mean, you can take more of it, it won't hurt, but if you miss a day, then that might result in premature ovulation. So that's kind of the exception to the rule. The other thing is the HCG injection, which sometimes patients need to take a bit less of it because they're at risk for some more excessive bloating if they have a very good egg reserve. So I very carefully talk to patients about the trigger dosage to let them know when you go home, you're going to need to be very, very careful about this, because we don't want you to take more than what I want you to take. Because if you by mistake take a little bit extra, that can be the difference between feeling fairly comfortable after retrieval and feeling very uncomfortable after the retrieval. So it's communication. It's putting the emphases, I think, on the drugs that have a little bit less leeway in terms of error.
And what about sort of pre-transfer and post-transfer? Do you find that patients get a bit anxious about preparing for the transfer and, you know, emptying their bladder and then, you know, is that right? Emptying the bladder for retrieval and then full bladder for transfer. Do you find that people sort of take that to extremes because they want to get it absolutely right?
Yeah, I do have a lot of patients who do think that if for some reason, if they come in with the world's most full bladder, that they will definitely guarantee an embryo implantation.
Yeah.
Because your bladder
Yeah.
should be full, and they will. So right away I let them know that they have overachieved and they need to release it because we don't want them to have, excruciating discomfort during the process. But yes, it's one of the things that comes up, and patients are always trying literally everything they can. They would stand on their head for a week if they thought doing that would make the embryo stick just a little bit better.
Mm-hmm.
And everyone always asks that question, what else can I do? What else can I do? You put the embryo, before you put the embryo in, well, what can I do before the embryo goes in? What can I do after the embryo goes in? The truth of the matter is there's not very much you can do. You have to take the medications as appropriate as you can. And you have to trust that a good quality embryo in a well-prepared uterine lining will do the job most of the time. There's always that God factor that comes into play where you get everything as wonderfully aligned as humanly possible, and still, even chromosomally normal embryos don't implant more than 65% of the time on average. So,
Mm-hmm.
you know, the percent
I
put in
to get
place.
very affected by the thought of, because I'm so stressed, because my body isn't the best shape it can be, because I'm so stressed, is this going
Mhm.
to affect implantation? And then I tried to remind myself that, people get pregnant in all sorts of terrible situations, or war zones where they're in a very stressful environment. So, as you said, some things you just cannot control.
Absolutely. Ideally, stress would be for everybody undergoing this process, but it seems like, the current pandemic is the pandemic of stress. I tell people that if stress was the ultimate deciding factor about whether or not you were able to conceive, there's not a woman in all of New York City that would ever get pregnant,
Very
because
true.
everyone leads a busy life and have a lot of responsibilities, and on top of that, here is infertility. But your point is very, very well taken. I think the stress has to be to an extreme level before it has any ramifications. At least the data doesn't support that it would. And usually if it gets to an extreme level, your first clue that is at an extreme level is that you just stop ovulating. Women develop something called hypothalamic amenorrhea from stress, where they almost go to a prepubescent stage. They don't really ovulate. And that's
Wow.
women that are undergoing stress from grief or physical activity or emotional stress, things along those lines.
Mm-hmm. That makes sense. And the effectiveness, sort of techniques for managing stress or go-to, do you think that things like hypnotherapy, acupuncture, counseling play a role in helping your patients?
I don't know so much about hypnotherapy. I suppose it could be utilized effectively for that, but I can't say I've ever actually promulgated that for my patients. But it's interesting. It's an interesting concept actually that you've brought up in that respect. In terms of acupuncture, I think acupuncture definitely. I mean, if you go to acupuncture and you sit there and you're cringing the whole time because it's just not your particular cup of tea, then probably doesn't make a heck of a lot of sense to do more acupuncture. But I find more often than not that when women do acupuncture, they say it's a relaxing thing for them. A lot of them will actually fall asleep during the process.
Mm-hmm.
Very soothing, and not to mention the fact that it's doing something, to potentially improve pelvic blood flow or some other mechanism that might actually improve implantation. I mean, studies, and it was a good study in the British Medical Journal that suggests that implantation was actually improved a bit. So I think that's something which is enhancement. It's, again, it's not a deal breaker or maker, but it is an enhancement. And a
Mm-hmm.
lot of women do find stress reduction. And counseling always, I think, is good. It's always good to talk. So
And
whether it's,
sometimes good to
I'm sorry,
talk to someone that you're not trying to potentially have a baby with,
yeah,
or a family member or a friend who might not fully get it. I sometimes find it easier to talk to someone I don't necessarily know as well. And I had counselling during my treatment, and I was sort of in floods of tears talking about things, and it was just a way of sort of releasing that stress, releasing that anxiety. Um, even to someone that I didn't really know. And I think that that's what people relish about this sort of trying to conceive community, is you can feel very connected to someone who's going through the same thing as you, even if you don't know them that well, because it's a shared experience.
Absolutely. Absolutely. I really do think that it's the difference between sanity and insanity during the process. Have at least one compassionate ear to speak to a couple times a week, to let them know that you're not doing well, or you are doing well, or, you know, just to get it off your chest a little bit.
Yeah, yeah.
And the difference between let's face it, not as much as we try, and we try very hard, not everyone is going to meet with success. And I think also, if you have somebody for the process and after the process to be with you and go through things with you, it means a difference in terms of your perseverance and how you will proceed. Because some people will not succeed and say, well, that's it, I'm done. And I know in my heart that there's a shot there if they would persevere. But people that have some sort of support network, someone to bulwark them against the stress, they very often will go through the process maybe more than once and actually get to that end point just because they had somebody there to lean on.
Yeah, absolutely. That's a very good point. And any sort of must-dos or pre or post-cycle that you would recommend to your patients? You mentioned sleep, which I think is important, and some of the things that you mentioned also, if they're not going to be detrimental, and then they're not going to sort of cost a lot, why not try them, right?
Yeah, I mean, that's how I feel about supplements, and in particular antioxidant supplements. There's something to be said for enhancing the fertility milieu overall, your health milieu overall. There's a lot of studies to show that certain compounds actually they actually mimic the compounds that you see more prevalently in people that have better health or better longevity. And you can actually take supplements that mimic that. And there's studies published that actually can affect in animals anyway, fertility and ovarian lifespan. So I think this is a burgeoning field, and I recommend certain key supplements to my patients. So I think that's a big shout out for me for that. One of the key compounds I recommend is something called NMN, Nancy Mary. You can actually Google it, NMN. There's a doctor from Massachusetts General Hospital, Dr. Sinclair, who does a lot of research with NMN and ovarian longevity and human longevity in general. He's a pretty famous gentleman. And I read a lot of his literature and try to take my supplement recommendations from the literature. In terms of just simple things to get through the process a little bit more sane and a little bit more preparation, I think you should make sure from the beginning you have all the medications that you need. So when your medications are ordered, look at them, document them, and come in when you see your doctor the first day. This is what I have. Am I missing anything? Because you don't want to be there late at night realizing I need this shot and I don't have this shot, which unfortunately happens quite a bit. If you know that you're going to be traveling and maybe you won't get home at a certain time point because you're going to be at a wedding, or you're going to always plan a little bit ahead to have your medications with you, so you're not in a position where you need to take something and you can't.
I love that. Good advice, really good advice. And what about exercise? Do you find that patients are a little bit worried about doing too much, too little, swimming, you name it?
I do have a lot of patients that are very, very ardent of their exercise regimen and don't really want to change it during the process. I don't think you need to change it during the transfer protocol very much, unless it's ridiculously, athletic, where you're running an ultra marathon or a marathon. You should probably let your body know that I'm thinking about pregnancy now, so I'm going to cut down on the physical activity just to get your body into that sort of recreative, procreative mode rather than a recreative mode, so to speak. I think there's something to that. But regular as regimen for transfers doesn't really have to be changed. If you are doing IVF and you're stimulating your ovaries, it does have to be changed. I mean, once your ovaries get to be a little bit enlarged after the first 5 or 6 days, you really should be doing minimal to no exercise, because you don't want to jostle your ovaries, put them in a position where they may flop into that is going to decrease their blood flow and create a torsion of the ovary. And this is something that you should be mindful of for about a week before the retrieval and probably for at least a week to 2 weeks after the retrieval, because they're going to be big before and big after for at least a week or two. So if it's low impact, walking around or, maybe just gentle weights without really jostling yourself, that's probably acceptable. But anything that's
Okay.
going to some movement is not going to be very, very helpful.
For anyone who has joined, Sher Fertility Solutions, Dr. Tortoriello has written a fantastic article about staying sane during IVF, top tips, what to consider, what to perhaps, how to help from a medical point of view, but also from a mindset point of view. So please head to our link in bio to read more. Please contact their wonderful team to book a consultation. They would love to help you on your journey with a personalized plan and consultation. Thank you so much for your time today. We really appreciate it. Is there anything else that you'd like to say to our listeners today?
I don't have anything in particular to say, but I am always available. You can go to our website, actually has a ask the physician a question.
Oh, brilliant.
If you go to our website, Sher Fertility Solutions, you can always just anonymously ask myself or Dr. Sher a question. And we're pretty good about getting back to you pretty rapidly. We're here to help and provide our knowledge and our service, and we do it gladly.
Fantastic. Absolutely. Well, we're very lucky to have you here today. So thank you for sharing your expertise, and please do get in touch with their wonderful team who will definitely be able to help you on your way. So thank you very much.
Oh, thank you so much. It was great to chat with you today. Have a great day, everyone.
Absolutely. Thanks everyone for joining. See you soon. Bye-bye.
Bye-bye.